Welcome everyone for tuning in to Mind Path Care's live broadcast information stream. Today we're going to be discussing the COVID-19 crisis and how it's affected the mental health and well-being of parents with teenagers that are in high school, and what the parents are maybe experiencing and going through, and how we can improve and promote effective mental health for the parents, as well as what the parents can do to maybe help promote effective mental health for their teen. First of all, I'd like for you to take a look at the description at the bottom of the video. There's a link to mindpathcare.com /telehealth for any questions, or if you're looking into either book an appointment or just get a little bit more information about the telehealth service here at Mind Path Care. Please feel free to click that link and start that process today. First of all, I'd like to introduce myself a little bit. So my name is Christopher Riggin. I am a psych mental health nurse practitioner. I have been with Mind Path Care since October, but I have been in the medical field for going on 19 years now. I've worked with UNC Hospital. I've worked with Duke University Hospital. I really was drawn towards the psych mental health realm because I feel like it is a overlooked part of healthcare. I feel like a lot of times people's mental health and well-being is not taken a high priority with a lot of the other specialties. And I think it is a huge part of a person's everyday life. A lot of times improving health and wellness, mental health and wellness can improve blood pressure sometimes just by reducing anxiety, and it can make a person more active by improving upon depression symptoms. So that's why I kind of got into it. I'm located at the Wake Forest office for Mind Path Care. It's 110 Capcom Avenue. I see a wide range from child and adolescent up to older adult. I specialize in attention deficit, as well as anxiety, depression, mood disorders. I have a background in therapy, so not only am I a medical provider for medications, but I like to incorporate brief therapy sessions in with my clients as well, to kind of give them a little bit more understanding about what they can do on their own to promote health and well-being. Let's start a little bit about sort of some general things that the whole COVID-19 has brought upon us. We are creatures of habit, and our habit typically in our household has been two parents working, kids are in school, maybe there's an after-school program. The family dynamic where they were actually together and doing things together previously was about maybe a 2 to 3 hour window in the afternoon, where people were eating dinner together, maybe getting caught up with their day, and then kids were doing some leisure activities, and then families were going to bed. So it was not a lot of interaction in our previous environment. COVID-19's changed that. Now people are more are forced to interact with each other. Whether that's a good thing or a bad thing, it depends on what they aren't able to go to, recreational activities, and everyone is just sort of confined into the house. So today we like to see what we can do to try to improve that interaction, maybe improve the stress and anxiety that has built upon these restrictions that COVID-19 has done. The first thing I like to talk about is trying to adjust to a new schedule, a new routine. I know a lot of people are excited about the restrictions being lifted so they can do what they say, return to their old routine. That probably isn't going to be the case. When you look at the therapy aspect of it, a lot of times when people try to return to a previous routine, they end up having difficulties or are unable to do that, because you have to realize it's not that same routine. Now you're in that same routine, but with a different experience. So that's what you have to look at now. Even though you're trying to go back to your previous routine, you now have that experience of what the COVID-19 restrictions have done, which is going to make you think about things differently. It's going to make you process those interactions differently. So the most effective thing to do is try to adjust to a new routine. Since we are doing everything from home, it's a good idea to try to set up a new schedule. Even though you're not getting up to go to school, have your teens get up at a certain time. You can have a little leeway fluctuation in there, but have them get up at the same time. Have them eat breakfast. Get ready to start the day as if they were going to go to school. Then having a set time for instruction of their day is done. Then you also need to have some leisure time. You allow your teens to be able to interact with their friends, be able to enjoy, video gaming if that's what they enjoy doing, reading a book, or even going outside and doing an activity outside. Here at Mind Path Care, we're trying to adjust the view of social distancing. We wanted to sort of view it more as physical distancing because we still want people to remain social. And there's plenty of options of remaining social without having to be, physically close to a person. So if, kids are able to still interact via, texting or any other media platform, that's great. It's good for them to do that. It's good for them to have that release so they can, talk about things that happened in their online school. Or even if they have questions, they can bounce those off each other. And then after you have that moment of leisure, you have to incorporate sleep as well. A good 8 hours of sleep is what's suggested. I like to think of this breakup as like do it in 8 hours, 8 hour increments. So you have 8 hours of your day from like 8 to 4 is where you're doing progress. And working and doing things school related or that sort. And then another 8 hours of your day will be for leisure or doing things that you may need to do around cooking, eating, those types of things in the afternoon. And then you have 8 hours where you're trying to get good effective sleep. So that's sort of a quick breakdown of an idea that we have to adjust to our new schedule. A lot of kids that I've spoken to that I see in office, they don't really have a structure schedule right now. They're kind of sleeping when they want, sleeping during the day, doing class schedules, randomly whenever they're open throughout the day, and just kind of laying around the house because there's not much to do. So by getting into that routine, you would provide a little bit more of an opportunity to adjust and to become more effectively efficient with your schoolwork and your daily activities. I'm going to take a moment here to take some questions. If anyone has any questions, please type your question in and I will see if I can answer it for you. Especially try to have your questions related to what parents may be dealing with their teens during this COVID-19 crisis. Or if it's a general question, that's fine as well. But I'd like to try to keep it on that topic if we could. All right, so we have a question come in. How can I keep my teen from becoming addicted to electronics during this isolation? That's a great question. The issue that a lot of parents do with electronics is they offer it as a reward. They use electronics a lot of times to say, okay, if you do this task I ask you to do, I will give you extra time for your gaming or your electronics. That's really not the most effective way to do that. Research has shown that by making something a reward, what it's doing is it's validating it in your brain as that's something really worth doing. So same way as you wouldn't want to have, unhealthy food, sweets, sugary foods as rewards, same thing can go be said for electronics. If a child says, okay, I really need to do this to get, this extra online time or this extra tablet time, it just validates it in that brain, in that chemistry pathway that this is a really good thing. We need to try to do what we can to do this. So a good way to counterbalance that is, I understand we are in the information and technology age, so a lot of stuff requires that technology and that information. So a good thing to do is sort of have set times, not added times, not say do this and you get this time, but have like 30 minutes periods throughout the day. So, you get a 30-minute period in the morning, 30-minute period in the afternoon. What that's going to do is it's going to be part of that routine again, and it's not going to trigger that response of this is something that I'm going to work towards to do. A lot of times when that's the issue, kids actually back away from using the electronics as much because they don't see it as a reward. They just see it as part of the day. So they kind of incorporate it into their routine. Another thing to do to help with that is we have to lead by example. It's children, especially young teens, get a mixed signal when you're telling them that too much electronics is a bad thing, and then they look over and you are on your phone as well, on whatever social media platform, and you're constantly using that as well. Not saying that's a bad thing. I'm not here to tell a person how to be a parent or how to live their life. But if you're wanting your child, your young teen, to back off of social networking or back off the use of electronics, they have to see that you're doing the same thing. That way they can see, well, mom's interacting with me, dad's interacting with me, and they don't have to have this electronic. And what that's going to do is going to open up communication. That's the key. You want to open up communication. You want your kids to talk to you. You want them to feel like you can discuss those things with you. So I hope that was a benefit for you. We have a second question coming in here. How can I support my teen's self-esteem with the onslaught of social media expectations? Another good question. A lot of social media questions here, and that's great because that is our current environment we're in. So with social media, it's tough because a lot of teens are seeking validation from their friends, their peers, random people. If you have followers on your social network, getting that like button, it's giving them affirmation. Whether or not it's valid affirmation, research would say probably not, because you don't know where that affirmation is coming from. And a lot of times you do things in those social media platforms that you think other people will like. That's why it's called a like. So in these times when social media can be kind of harsh sometimes, we got to provide that as parents to our kids. We got to provide that affirmation. A lot of times in the parent role, we do a lot of correcting. We do a lot of disciplinary things. So it ends up being a lot of your communication back and forth with your teen is correction, or saying you need to do this differently, or you did this wrong, or I need you to do this. It's a lot of demands, a lot of correction, and a lot of times teens don't take well to that because they are seeking affirmation. So what we can do as parents for teens, we can try to provide more affirmation for them, even for small things. So definitely do correction, because that's what a part of a parent's job is, but also let them know the things they're doing right. If they, even if it's a small thing, so like they made their bed that morning, say, great, I really appreciate you making your bed. That's awesome. That saved me having to do it. And I'm sure, it makes you feel better coming into your room and seeing a nice clean room. When you switch it that way, when you format it that way, they can see that their actions has a positive result for them. So they don't have to come into a messy room. They're coming into a clean room because they made that action. They cleaned the bed. Also, giving random comments of affirmation impacts more than something that is expecting a positive thing. So they do a good job. They're expecting, your teen is expecting a positive affirmation. So it is taken, but it's not taken as with much of an impact as it would be if you just randomly say, I want to say thank you for being a great kid. I want to thank you for, adjusting to this new COVID-19 online curriculum that you're having to do at school. I know it must be difficult. But I want to tell you, thank you, that I've noticed your progress. I've noticed the actions you've taken. When you do that for a team, it makes them, one, uh, realize that you are paying attention to them. Um, that's one thing that social media does for teens, is they get paid attention to. It might be from strangers, or it might be from their social group, but they're feeling like they are noticed. They're being paid attention to. I think that should also come from the home. That should come from the parent, from the family. So any opportunity you get to randomly give positive affirmation to your team, do that. Let them know how proud you are of them for the little things that they do on a daily basis that is probably expected, but they may not get that affirmation from it. So that was a very good question, and I hope that answered your question. See if there's any other questions. I do apologize for some of the technical difficulties today. This is my first time doing this through YouTube Live, so I'm going to have to work out some of the kinks, but hopefully it is flowing effectively for you guys. We have another question coming in. My teen feels a profound sense of loss and grief due to the cancellation of graduation and prom. How can I help him or her through that? That is a really good question. I actually had this brought to my attention recently. So we have to realize that it's out of our control as far as what the school does. So the school is limited to what they can do. So if the government says that they cannot have prom due to the gathering of people in a small contained area, they have to abide by that. So, but what we can do, we have to look at what actions we can do. So celebrate the commencement ceremonies with your kid, right? So you celebrate it as a family, have them get dressed up in their graduation regalia. Take pictures, you can go outside, take pictures like they would with regular graduation. Send those pictures to family members, friends, post them on social media. Celebrate this time, even though that the school is not going to have that opportunity. We can do that as family members. We can do that as parents. Have the opportunity to, once they get their diploma, because I believe they're going to be sending diplomas in the mail, present your child with his diploma, videotape it, have it as a memory, live stream it if you'd like. But we need to celebrate it because this is it's definitely an achievement in your teen's life. It's definitely a stepping stone going into their that young adulthood into college. So we need to express our joy and our excitement with that. So even though the school is not allowed to have gatherings for graduation, we can do that. We can record it for our kids. We can have several of his friends or her friends do it all together and make a video montage. So that's one thing you can do for that. And as far as the prom, that's a little difficult with the physical distancing. But what you can do is, because I'm sure these restrictions are going to be lifted, hopefully sooner rather than later. But once these restrictions are lifted, schedule a time to do that. We don't have to have prom on the scheduled prom day that was typically scheduled. You can celebrate prom in the middle of the summer. It may not have as many people as it would have, but you can get your social group together and all agree, hey, let's go get dinner at this restaurant. Let's all get dressed up in our prom attire. And then maybe you can rent a place to have a small gathering of that they can actually enjoy dancing and socializing with their friends like they would have at the prom through school. Again, I understand it's not the same thing, but again, we do have to adjust. We have to try to make the efforts to gain that experience. Kids shouldn't lose out on that experience. It's one of those things where when one opportunity is not available to you, you can either sit back and say, well, I'm never going to have that opportunity, or you can take action to create a new opportunity. And that's what I definitely stress, and I definitely want to promote to people. Let's make new opportunities. We cannot change the fact that we're not going to have certain opportunities, but we can take action to make new opportunities. This kind of leads into another part of this is mindfulness. I'm a huge advocate for mindfulness. It's a DBT, CBT therapy technique. Mindfulness is not new. It's been around for a long time. Mindfulness is, you can go back and see mindfulness in several different aspects of religion. Depending on which religion you follow, you can find aspects of mindfulness there. There's a quote, some of you may know where it's from, that is, grant me the serenity to accept the things I cannot change, the courage to change the things that I can, and the wisdom to know the difference. That's mindfulness. What I mean by mindfulness is you have to realize there are things that you don't have control over. You have to accept those. Once you accept that there are things that you have no control over, you have to find, well, what options do I have? What things can I change? Then we have to take that risk. We have to take that action, take that courage to make those changes. And then the huge key is you got to know what the difference in those are. A lot of times, if you can consistently try to change something that you really have no effect on, it's going to cause us stress. It's going to cause us heartache. It's going to cause us, it's going to impair our mental health because we're not seeing results. We are a huge culture of results. I want an action and then I want a result from it. So once you find those things that you can't change, and notice those things that you can't change, and then start focusing more on the things you can, it gives you a better outlook, gives you a more positive outlook. It gives you a direction to focus your efforts into. And there was a document, a discussion written by our medical director here at Path Care, Dr. Scott Jeffries. He recently was mentioning some things that we can do to improve our mental health through this COVID-19. And one of the main things was mindfulness, he mentioned. And he had a good reference of what mindfulness, a good visual interpretation of mindfulness. Say you have a waterfall, right? That waterfall is representing the stressors and the tasks that you have to do. Now, if you're standing under that waterfall in the midst of all that pressure hitting you, it's going to pummel you. It's going to knock you down. It's going to make you feel like you can't get through it. And you stop seeing the positive and the beauty of the actual waterfall. Mindfulness is taking a step back, right? So you take a step back, and now you're not being hit so hard from the stressors and the task. And you're able to look at and say, oh, okay, this is what I'm seeing. This is what's affecting me. I can't control this. I can control this. Let me work on the things that I can control. That's stepping out of that waterfall. That's mindfulness. Now that's noticing your place, your presentation in your current surroundings. So that's kind of a quick, small version of mindfulness. I don't want to belittle mindfulness by any means because it's a very effective mindset. It's a very effective technique that CBT and DBT therapists use all the time. We have those therapists here in MindPath that use DBT and CBT to help people with many life issues and trying to change that thought process about things. Sorry to go off topic there. I do have a new question. Let's see here. I've noticed that my teen is more irritable, and that's definitely understandable. Are there any tips to teach them to calm down before they outburst on a sibling or a parent? Sure, that is also a great question. That is an impulse. That is an impulse reaction. That's an impulse behavior. A lot of that comes from anxiety. When you look at how anxiety affects us, anxiety is in that realm of panic, fight or flight, right? So as our anxiety increases, our tendency to lean towards panic or fight or flight also increases. When that happens, you have physical reactions. That's your heart rate elevates, your breathing elevates, you may start to be sweaty, and now your mind is looking for a quick out, a quick way to escape whatever this threat is, whether it's all the stressors that are coming at you, whether it's a social gathering and you have social anxiety. So our first response is an impulsive reactive response when you're in that panic mode, and you tend to lash out. You tend to be aggressive or say things that hurt people's feelings, because then they leave. They don't interact with you. Now that threat is gone. But what happens then is about 5 or 10 minutes later, as you calm down, you realize that that's not how you wanted to do that, and you feel bad about interacting that way. So a good tip for young teens who are getting irritated quickly is they need to separate. They need to put a pause between a thought and an action. A good way to do that is controlled breathing, which is another mindfulness technique. Controlled breathing, it allows you to lower your heart rate, it allows you to control your breathing so that you're not letting the emotion make the response. You're thinking about how you want to respond and what the consequences of those actions would be. Very quick controlled breathing technique through mindfulness is called box breathing. What box breathing is you take a deep breath in for the count of 4. You hold it for a count of 4. You exhale for a count of 4. And then you pause. And then you start that breathing technique again. You breathe in for a count of 4. You hold it for a count of 4. You exhale for a count of 4. And then you pause. It takes 15 seconds, 20 seconds. It doesn't take very long to do. And what it can do is keep you from allowing an emotion to make a response and let you actually think about how you want to respond. I know sounds very simple and easier said than done, but once you start incorporating that practice, once you start incorporating a pause between a thought and an action, it becomes second nature. Research has shown that doing an action repetitively for 30 days is the best way to create a new action or break a habit. So if you can take this technique, the box breathing technique, and put it into use every day and try to make it part of your routine when you feel like you are having an increased stressful moment or an increased anxiety moment, try to control your breathing, try to keep your heart rate from elevating so that you're not allowing that emotion to make a response. You're actually thinking about how you want to respond. So I hope that answers your question. I hope it's beneficial for you as well. Let's see. I think that is the last question we had. I wanted to make sure I answered anything that was questioned of me. So I think that is going to wrap it up for today. I definitely appreciate everyone tuning in. I hope this has been beneficial. I really do. That's the whole point of these online education sessions is to provide information, also to provide techniques that you can do at home. I want to build that toolbox for people. That's medication is definitely helpful to control to manage symptoms, but medication doesn't cause action. So that's where people can actually take action to improve their mental health and well-being. I hope some of these tools will be helpful and beneficial for you. Again, if you need further information or you're seeking some mental health and wellness education or some mental health and wellness assistance, we will be happy to help you here at MindPath Care. Please go to the link at the description of this video below and click on that link, mindpathcare.com/telehealth. Schedule an appointment with a provider. We have a multitude of very exceptional and educated providers that are ready to do assessments or speak with you or see what they can do to be beneficial for you. So I hope you have a great day. Remain positive. We're going to get through this together. We have to remember we're going to change that mindset, not social distancing. We're doing physical distancing. Remain social, remain in contact with your friends and your loved ones, remain positive, and we'll get through this on the other side. Guys, have a great day.